And you bought a home within your first 2 years of practice?
Yeah, as when I was graduating, I was also signing on a house, actually.
Really?
Yeah.
Oh my God.
hmm
That's amazing.
Yeah. They take over paying all your tuition. They also give you a living stipend every month and give you a lump sum at the beginning of each year that you're in school to kind of pay for other reasonable costs, is what they call it. So books, stethoscope, whatever it may be.
But yeah, so you went to PA school for free?
Yeah, pretty much all my tuition paid for. So I did the National Health Service Corps scholarship. It's a scholarship where you essentially agree to work in an underserved area, whether that be rural or urban, for the years of support that they give you for tuition. Yeah, so just wrapped up my 2 years at a rural clinic, and it's been great.
Is that really competitive?
So as far as I know, the year I applied, everyone in my program who applied got the scholarship.
What?
Yeah,
Really?
it's a nationally funded scholarship, so that can vary based on, political climate and funding and things like that. But overall, there's a lot of need, so I think the funding's still there.
Actually, you brought up something I wasn't going to ask you about, and we're not going to like steer into the political realm because it's just not what I do. But I don't know if you still kind of have like your finger on the pulse of this whole situation with getting stuff funded in the new political, climate where they're kind of cutting a lot of government support for things. Do you know if this scholarship has been cut, if there's fewer spaces?
As far as I know, it hasn't been impacted yet. They haven't, they sent out some emails with updates on things we need to be aware about in terms of funding, and there hasn't been any updates that they're going to cut it. In fact, there's still other repayment options that are in place, if you do have lingering loans. So for now, it's looking good, but I'm not sure.
For healthcare for rural folks, because I mean, the whole reason these things exist is because somebody like you or somebody like me, 20s, 30s, we get our PA degree, we want to work, we're making a decent salary, we go straight to like a desirable city, Tampa, Raleigh, New York City. Well, New York City is different. And then sure enough, those areas get oversaturated, and who gets left behind is the folks living in, I'm not going to say where, but rural North Carolina, right? And they can't find somebody. So then they have someone like Courtney, they incentivize her, like, hey, by the way, do you want to be 200 grand in debt? Or do you want to be in zero debt and then, maybe help these folks?
Yeah.
Is that kind of how it works?
Pretty much. And I'm still not too far from a major city. I can commute in and see my friends, things like that. But I have pretty much no student loan debt. I was able to buy a home straight out of PA school. So, overall, it's been very worth it for me. And honestly, the patient population, I think I appreciate taking care of them even a little bit extra because the gratitude is just tenfold. So.
I don't know what to ask about first because there's so much here. The main thing is like people who graduate with a PA degree, they did all this work to get in and all this, and it cost them a lot of money and a lot of time. And then they graduate and they're like $250,000 in debt, sometimes more. And then of course, no one's even thinking about, buying a home right away. No one's thinking about, upgrading lifestyle. They're just kind of like, how am I supposed to get out of this? And you bought a home within your first 2 years of practice?
Yeah. As when I was graduating, I was also signing on a house.
Really?
Actually. Yeah.
Oh my God. That's amazing.
Yeah.
So you've been practicing
home ownership as well.
You said what? You've been practicing 2 years?
Correct. Yep.
And you signed a home as you were signing your first job. Okay, guys, everybody on TikTok saying like, oh, I can't buy a home. Right?
And you're living outside of us, there is actually urban jobs as well. I chose more of a rural setting, but because you live where you work, the cost of living is lower. So, accessing a home was a little more accessible to me right out of school. So
that's actually interesting because when I think NHSC, that's National Health Service Corps.
Correct.
Right. So let's actually do this very, very quick, just so people, watching this video, I'm sure they would love to hear both of our takes on these things, but I actually want to just like give them the info they're looking for right away. So NHSC.
So the website is HRSA, the health I forget what it stands for.
HRSA. That's
it's NHSC.HRSA. That's it.
This one right here. Okay. So you just basically go to nhsc.hrsa.gov, how to meet eligibility requirements for the scholarship. And then, so can you just kind of talk me through this real quick? How'd you become eligible for this?
Yeah. So anybody, PA, NP, MD, DO, anyone who's going into a provider education program, once you get accepted and commit to whatever program it is, and you pay your deposit, you can then apply to the scholarship. It opens up in the spring, but you don't get notified of the scholarship receival until like September. So for example, I got accepted into PA school, I think it was May of my year, immediately put in my application for this. And then I went ahead and had to take out my first loan disbursement like everybody else. But then I got notified of the scholarship in September of that year and was able to pay back that first loan installment. And then from there on, they take over paying all your tuition. They also give you a living stipend every month and give you a lump sum at the beginning of each year that you're in school to kind of pay for other reasonable costs is what they call it. So books, stethoscope, whatever it may be. In order to qualify, I mean, pretty much the only thing that would put you out of not be a candidate for it would be if you had a history of like bankruptcy or some really concerning financial background, because they want to know that you're not going to just take the money and not complete school. Right. Otherwise, they say they give preference to people who come from a disadvantaged background. For example, I'm a first generation college student and came from an area where not a lot of students from high school went to college. A lot of students got free and reduced lunch. So there's a form that you fill out if you meet some of those requirements. You kind of get first pick. But like I said, my year, I think everyone got it, and I had classmates who their whole families were in medicine. Like it had nothing to do with them getting the scholarship. But
oh wow,
they do say they take priority for those people.
Yeah. So it's not really a need-based scholarship. It's it's just a program. Like if you honor your commitment to work at a, medically disadvantaged area after graduation, then you got it. Doesn't matter if your parents can afford to pay for tuition. It really does not matter where you come from. Anybody is eligible for the scholarship, which I think a lot of people will be very happy to hear about. You said, what did you say? You said everybody in your class had gotten it, and it opens up in the spring. So I imagine it's best to apply for it like right away in the spring.
Yeah, as soon as you know. I'm not sure about other programs, depending on start date, if they would back pay like a full year. I can't speak for the scholarship. I'm not sure. But like for me, I had already taken out my first semester of PA school of tuition, and they paid it back. So.
Okay. Because that's what it said. It said not just necessarily accepted and starting a program. It said already enrolled in a program too. Yeah. See right here, attending or accepted. So, I mean, the ideal thing to do is as you're applying to PA programs, and ideally you're doing that in the spring, right? April, as soon as it opens, May, then you're also applying to this thing too. But then also, can you even apply if you're not accepted yet?
You have to have paid your deposit and like know where you're going, because you have to list who you're going to, and you have to get a letter from the program that you'll be attending as like a letter of reference. But for example, I hadn't even started school, so I just emailed and said, who writes this letter? And they reached back out and sent me the necessary documentation, because I think you need 2 letters of reference, one from the program that you will or already attending, and then one from another clinical role, your clinical experience prior to PA school. And then there's a couple essay questions, but they're very brief and pretty straightforward, just saying like, well, why do you want to do this scholarship? Why do you want to work in an underserved area? And that was pretty much it. So. Yeah.
So as far as motivation and as far as like filling out the application, it sounds really similar to the life experiences essay. It's talking about serving underserved folks, from around the country. So it's going to be kind of like that. The issue is this opens up in the spring, but you have to already be accepted.
Correct.
Means you're not going to be applying in the spring unless you apply to one of those programs that deadlines in January or something. Got your letter in like February, March, and then, okay, maybe then. But you're waiting to apply for this program until you have your acceptance letter.
Correct. So if people are getting off the wait list like closer till, they may have to wait till the next cycle to apply. Right. And it is a minimum 2-year service commitment. No matter how long your schooling is, it's a minimum. So I'm not sure if you only got 1 year of funding, if they would back pay, but you'd still have to serve for at least 2 years, if that makes sense. So for example, my PA school was 2 years, so I served for 2 years. The PA programs that are 3 years long, they'll pay for 3 years of tuition, but then you're signing a 3-year contract with a scholarship. And if for some reason you didn't get a position that qualifies, you would be responsible for paying back all the tuition like times 300%. So definitely need to it's like 3 times the amount that you were gifted or yeah.
Oh, that's, yeah. Wow. Man,
But I do have a friend who her first position after the scholarship was not a good job site. And there was a lot of things going on where the clinic might have shut down. And the scholarship worked with her, helped her find another site. And she had like 30 days to switch over with no penalty. She didn't have to pay anything back. So, worst case scenario, there's still, the scholarship program supports you. So,
yeah. So, okay, that brings up two things we're going to get to in a second, pros and cons being the biggest one, because it's not all pros, there's cons. That's one. And two is helping you find a job, because now you're in the job market as a new PA. You're not just looking for any job, you're looking for very specific jobs. So that's going to add some challenges and also some advantages. But before we do that, I just want to wrap up eligibility. So first things first, you have to be accepted or enrolled in a PA program, or medical school, dentistry, nurse practitioner. If you're already enrolled, let's say you finished off your first year, you can still apply and you can get your second year paid for, or in med school, years 2, 3, 4, whatever. Whether they pay for the first year back pay, we're not sure about that. But then you would still you would still have to sign up for 2 years of service, even if you only have 1 year paid for.
Correct.
So that's a big deal. Who is eligible? We just looked at that. It's any provider level. So midwife, nurse practitioner, physician assistant, dentist, physician, right? Not nurse, not EMT, not paramedic. Those are maybe different programs, but for this one, it's provider level.
Correct.
Right. Okay. Anything else to say on eligibility or application tips for this thing, or is that really it?
No, like I said, the scholarships, sorry. Like I said, the essays are really brief. After you've written all your essays to apply to PA school, it took me just a couple hours and it was done. So the application is very easy. Just do it. Just apply.
And again, they pay for every dime of tuition.
Correct.
Like no student loans, all tuition paid for. They give you a housing stipend. Is it enough for like a cardboard refrigerator box in the alley, or is it enough for an apartment?
2 years ago was when I was in school. So at that point, after taxes came out, it was about $1,300 a month. So for me, it didn't quite cover all of my expenses because I came in with like a car payment and things. But for some of my peers, like it covered pretty much everything month to month if they budgeted well. So
yeah, I'm assuming that's going to probably vary on where your school is.
So that was the nationwide, like that is the stipend. Like that
really?
was set rate. I don't know if it differs for like MD versus PA, but as far as I know, that's the set monthly stipend that the scholarship is.
Because I was thinking like cost of living, like high cost of living versus low cost of living areas, they don't care.
Correct. No.
So anywhere.
You pay your tuition regardless of how much your tuition is.
Sure. Oh, okay. That's different. So I had the GI Bill and it like depends on where you live. So Honolulu, you get allowance for housing. That's like $3,000 because that's how much it costs to get a tiny apartment. But like, rural Pennsylvania, they might give you like $700 because that's how much it costs for a tiny apartment. But it's a flat rate of about $1,300, maybe $1,500 or so.
Yeah. So
per month.
So for me, I mean, I was in the mountains of North Carolina, so cost of living wasn't terrible, and I had roommates, so it worked for me. But I'm not sure about people in bigger cities or things. You'd have to consider that.
And they gave you like a little book allowance, maybe $1,000 for books, stethoscope.
It was like $7,000 a year extra, just like a lump sum. So then you can also incorporate that into your budget, kind of sprinkle that throughout the year.
That's a lot of money.
It was a nice lump of money.
Man, that's nice. Yeah, I mean, that's enough for housing expenses, food for the year, that kind of thing. Because I think the GI Bill, this was, again, years ago, but they gave me maybe like $1,000, maybe $900 per semester, I think. Either per semester or per year for books. But $7,000, I mean, that's a car.
It was somewhere around there. I mean, I was able to budget that out, and that's kind of helped. I still paid all my bills and then had some savings left over for, pants exam at the end, things like that.
Sure.
So.
Wow. So yeah, they pay for all books, all expenses. If you budget properly, all housing, food, all your tuition. So you can essentially go to school and have living expenses like just taken care of. So all you got to worry about is just getting through school instead of, worrying about where your next meal is coming from. Can I pay rent? When's my student loan going to hit? How I'm going to pay this thing off? Like it's just worry free.
It was wonderful.
That is the pros. Here are the potential cons, not necessarily cons, but what you have to do, like what is your commitment after graduating, having everything paid for?
So you have to get a qualifying job, and mostly is family medicine, full spectrum family medicine, but pediatrics, women's health, and psychiatry jobs do count. There was just less of those in the areas that I was looking. You go to the NHSC website and they have the HRSA, the HRSA Workforce Connector somewhere on this website. And that actually is a map of the entire country of all the job sites. And you can filter by sites that have jobs posted on here, or just look for sites in general. And when you get the scholarship at the time, like in school, you'll be told a number, and that number reflects how underserved the area is. So you can see on here, there's like 17, 18, things like that. So the higher the number, the more underserved the area is, I believe. And so for me, it was set quite low. I think it was like a 10. So that opened up a lot of job options. It was a little stricter for MD level, but APPs, it was pretty broad, just because I think there was so many job openings. They wanted to make sure we're filling them. And so you look anywhere in here. And so you can apply right through the portal, or for what I did, I used it to look for job sites. And then I went to that job sites website, and sometimes they had jobs posted that weren't even on the portal, but they were a qualifying site. So the Workforce Connector, that's not only jobs that are on there that are openings, but it's any site that's on there that qualifies.
Interesting.
Really poor explanation.
So they made a whole little portal. No, that's perfect, because I didn't know about that. Because I actually have a friend, James. He's been on this channel. He's part of my, coaching practice, where he just graduated with a scholarship, and I see him trying to find jobs. He really wants to be in Raleigh, where I am, and he can't find anything right in the city. And so now he's looking at South Carolina and whatnot. I'm not sure if he knows about the connector. I imagine he must.
And the big thing is to not just filter on openings, but just looking for qualifying sites. Because some of them, like I said, I would go to their website and they actually did have a job posted. They just hadn't cross-posted it onto the Workforce Connector yet.
Okay. So not necessarily just applying through that portal, but just looking for the site and then just treating it like any other job, calling the place or seeing like on their website if they have a job posted, and then just applying like a normal job, but they are at a qualifying site. So that'll work.
Yep. And there's like pediatrics offices. Like, for example, in Raleigh, when I was looking, there was some openings. So that weren't on the connector, but they did have openings. The other thing is you still apply to a job, you interview, you accept a position, you negotiate, all separate. You have to find a qualifying site, but a lot of people think the scholarship places you. They do not place you. You still have open invitation to apply anywhere in the United States. That's a qualifying site. So, and I have friends, I think everyone from my class, the general area they wanted to be, they found a position and accepted a position in that area. So I had a friend who moved to Oregon. She found a site, New York City, all over, Charlotte, Raleigh, things like that. So
usually within like an hour of somewhere they actually want to be.
Yep. Usually about, I think everyone is about half an hour to an hour of their kind of goal.
Right. Which honestly, not a bad deal. Honestly, not at all. And so, I mean, it's like a normal PA job. I mean, you get a salary, you get benefits, you get a normal schedule. It's not like you're going into residency or being sold into slavery. Like you got a kind of a normal job. Just happens to be a population that the government's really trying to incentivize you to help. And then you've already, had everything paid for. So that's good. Do you find that these jobs tend to be lower paying?
So actually, I mean, for me, in comparison, I was actually making more right out of school than one of my peers who was closer to the city that I live in or live near. And my schedule, I felt, was a little more ideal. I had better benefits. So my organization in particular, I think, recognizes the difficulty of the patient population and pays fairly. But there is a lot of variability. So I just encourage, if people do get the scholarship, like, don't just settle for a job just because it qualifies. Like, make sure you're still getting a position that supports you financially and lifestyle. But yeah, it's been great for me.
Wow. And so, I mean, it's not really a con, but if you genuinely want to help different kinds of populations, this is good for you because it comes with all these benefits. But yeah, like, I don't want to make super, what would you call it? I don't want to make a lot of assumptions, but some people might think, a suburban person who's had their health like looked after since they were 0 years old and, they have health literacy. They might be a little easier to treat than someone who's like lived out of the country their whole life, hasn't seen a doctor for 45 years. And now they're coming to you with all this need that's just never been taken care of, which could be a pro if you want to help these folks, which you should. could be kind of a con because they're going to be a little more difficult to treat. But do you find that rewarding? Like, do you like working with these populations?
Yes, I enjoy what I do. I came from a rural part of the state and,
Mhm.
healthcare desert. So it's a similar population to what I grew up with. So I
Sure.
enjoy what I do. But if you don't have at least somewhat of a desire to work with the underserved population, maybe don't do the scholarship and don't do it just for the money, because it is hard. The mental load is heavy. These patients are extremely sick. I have peers who work in more of like a fluid area, and they kind of stagger the complexity of patients between the APPs and the physicians. Whereas where I'm at, I'm the solo provider in my clinic most of the time. It's just me. So it doesn't matter how sick they are. I'm the only provider for 30 minutes, like 30-minute radius. So I have a great supervising and collaborating physician that's accessible by phone. They're 30 minutes up the road to support me, but a lot of the times it's all on me. So, I have patients whose A1Cs are not even reading; they're over 15%.
Oh no.
I got to try to figure out how to help them, but the gratitude they give me, I mean, I really enjoy working with my patients. And sometimes it's the simplest thing, just explaining that bread is a carb that changes their whole world and gets their A1C down. And so those days are really fun. And then some days, yeah, I get home and I'm exhausted, but yeah, I've enjoyed it. And I plan to stick around at least for a while. We'll kind of see where life takes me, but
Yeah, the lack of health literacy sometimes is amazing to people who, have been trained, who maybe have been looking after their health since they were in high school. Just knowing that bread is a carb and then meat is not, and that yogurt does not have fiber in it unless it's artificially in there, like that kind of thing. And people are just like, "Yeah, I'm eating all this yogurt because it's got all this fiber." Like, sir, what are you talking about? I remember one person that just had, like, sometimes people come in and they're way better than you found them 3 months prior. Sometimes they're the same. This guy had dropped like 20 pounds. His finger stick went from, I think we got it in the 200s to somewhere in the mid 100s. Was looking better, feeling better, not peeing all night every like 5 minutes. And we're like, "What'd you do?" And he didn't really tell me much, but he told the receptionist, "Yeah, he just told me to quit eating bread." That's all it takes. Like, you just can't have that with every single meal if you're diabetic. And it could be the simplest things, and then you change their whole life, which is easy for us to take for granted, but for these folks, it literally changes their whole life.
the biggest one is I thought Sprite was better than Coke because it's clear. And
Well, a little bit better.
they have diabetes, and I'm like, well, they're both soda. They both actually have sugar, and I teach them how to read a food label. And just teaching a patient how to read a food label like changes their whole life. So
Amazing.
it's fun when they come in and they're empowered to take care of their own health, and they're excited about it. So a lot of my patients, I think people think that rural medicine, like none of maybe they just don't care about their health or things like that, and they just don't know, and no one sat down and taken the time to explain things to them a lot of the days. And just me explaining to them and building rapport with them, and they come in and get their health under control. Like it's awesome.
The one thing you said a few minutes ago that actually scared me a little bit, when you said you're dealing with like the sickest, the most complicated folks all by yourself. As a new grad, right? You've been doing this since day one. How?
Well, I did start my position. I was 2 days a week at the clinic where my collaborating physician works, and then 2 days at the clinic I'm at full time now. And at that point, there was a nurse practitioner who'd been there a few years working at that other clinic. And then she wound up leaving it was like 5 months into me practicing there. And so at that 5-month mark, I did move over more solo. I wouldn't say I recommend that. Like, it was a bit of an extenuating circumstance that I moved to a clinic by myself. But I will say I did work for about 5 years in family medicine and sports medicine before PA school. And I had a really great physician that I worked with who kind of treated it like a 5-year-long clinical rotation. Like, he knew I was applying to PA school and would teach me a lot of things and pull me in. So I felt like I had a little extra experience in rural medicine, but I call my collaborating physician all the time. Like, he's on speed dial. So yeah.
That's that's going to be something kind of hard for people to realize until after they've started even practicing for a few months. But so it sounds like you were very much more prepared than your typical new grad, right? Like, most people have a few months, maybe a couple of years of like CMA, CNA experience, maybe EMT, but they were not trained to be a family provider, especially for complicated folks, for years like you were before PA school. So I think a lot of people coming out of school are probably kind of ill prepared, and that's terrifying for the patients and for you, for your liability, for your license. So that's one thing to consider. Do you recommend this to most new grads, or would you say, unless you feel very well prepared, perhaps don't do this?
I think I recommend it if you vet the job you're applying to, and do they have a good onboarding process? Have you met your collaborating physician? Are they going to be a supportive person for you? Some of my peers who are in other positions who did the scholarship, I don't think they regret the scholarship, but maybe some of them have told me their positions aren't as supportive and haven't panned out to be quite what they expected. But they're still happy they did it. They feel more prepared to go work elsewhere in medicine. The base of knowledge that I've developed in the past 2 years is through the roof. So I just think vet the position you're applying to and make sure it's a good fit for you. But that applies even if you're not doing the scholarship. I have friends who went into urgent care right out of new grad, and they're by themselves all the time at an urgent care. So I think it applies outside of the scholarship too.
Yeah, that's a good point. And I mean, as somebody who's practiced in urgent care for 2 years and recently left, new grads and urgent care don't mix, guys. Please don't do it unless there's a fellowship, there's a really solid training program, at least for the basic stuff. Because it's not like it can't be learned. It's just that someone does have to teach you the basic stuff before you should be alone. In a primary care office, I could see it a little differently. At an urgent care, where people with low health literacy treat it like an emergency room.
Yeah.
That's dangerous.
I've had a few urgent things come through in in there, but not level of urgent care.
Right. Where people think you're the emergency room.
We do have people who call and say, I'm on my way with chest pain. And we're like, no, please keep driving.
Please keep going. Go to the hospital.
Don't stop. Don't pass go.
Exactly. Have you had any true emergencies like anaphylaxis, decompensated heart failure, asthma exacerbations?
I had probably my first scary one was acute decompensated heart failure. It was new onset atrial fibrillation with RVR. They were holding their chest. His heart rate was in the 150s, 160s, but he was in and out the door in under 10 minutes. He came in, I saw what was going on. We got an EKG on him, but EMS was already on the way. My team really supported me. That also helps. One thing I want to comment on is my clinical staff, my support staff. They're all, several nurses and MAs, but they've all been working there for, I think the least amount of time is 5 years, but my practice manager's been there for 15 years. She's a nurse. She knows the community. She's part of the community. So that helps a little bit too, because even though there's not another physician or APP there most of the time, these nurses are top notch and know the patients. They're oh, they've had 3 stents in the past year, so it helps me a little bit to have them supporting me. But yeah, the AFib, I was whew, this is, he is sick.
That can go bad real quick. But you have actual nurses like LPNs, even RNs.
Yep, I have 2 RNs and then a newly licensed LPN as of this week, and then a couple MAs. So they rotate through. But yeah, my practice manager, she's got my back. So
yeah, again, I know that's not what this video is about, but for people choosing a new job as a new provider, physician assistant, nurse practitioner, another kind of strike against urgent care and more of a benefit for something like this or a primary care clinic or anywhere in the hospital. Don't take a job where you're not working with other licensed providers, even if you're going to be a solo provider, which I, again, don't recommend. But even if you're not, if there's an LPN there, even an LPN, it's already way better for you than people who are just trained on the job as medical assistants, no licensure, that were possibly working at Sheetz or Taco Bell down the road a minute ago, and now they're medical providers. If someone's even an LPN, they have some base level of education and certification, your life is going to be so much easier. Because you're not the only medical person in the room now. If they see someone clutching their chest, they're not going to go back to their phone. They're going to be like, hey, we need to do something. They've been trained, they've been educated. So even having an LPN, RN, even an X-ray tech, someone who's legitimately been licensed, world of difference.
I would agree with that 100%.
And if there's another provider on board, it's just so much better. I promise, guys. By phone is not the same as, even if you guys, okay, this is the analogy I make. Even if you're seeing 100 patients a day and you have another PA or NP just sitting there doing nothing for you, but just sitting there as camaraderie, I would rather do that than see 50 patients a day by myself with no support, no help, no one to vent to, no one doing the same thing, no one to take over an emergency if something comes in. Just having another provider, warm body in the room, it just makes such a big difference.
Yeah. I have another PA with me one day out of the week.
That would be my favorite day.
Yeah, it is. It's busy, but it's good.
Yeah, like it's the workload. Like I could handle more workload
Hmm.
with someone just even there for moral support.
Yeah, I'd agree.
It's just yeah, just working solo. It's tough. It grinds on you. Not to make you feel bad about your job. One day you'll, but
Like
it
I
is
said,
rewarding.
my
What's that?
nurses I have, they're my lifesavers. So
That's another thing. You're not alone. You have other qualified folks who understand what you're going through. If somebody codes, they know CPR. You know that. If someone's in trouble, and you're not in the room or you're not seeing it, you know that they got you. Like
yeah, as
that's
patients come in and they've already got like a point of care, hemoglobin if they look pale, they have some clinical reasoning behind them, and
Mhm.
they catch things before I even have seen it. So
Yeah, that sounds like a dream come true compared to coming like so when I was in the urgent care, we didn't have that.
yeah,
Right? Like we had nobody who was medically trained. I was the only one. So if I go to the bathroom, I'm palpitating like what is going to happen in the next 2 minutes,
gosh,
like out there, because I don't know. Or like, yeah, it's just don't do it. Don't be the only provider licensed person in the room. Just don't do it. But it sounds like you have a really good gig. Where did I go? Okay, just zooming out. Okay, so I'm gonna probably wrap this thing up. But anything else you'd really like to tell people considering the NHSC scholarship, considering being a PA in general?
mm, I would just applying to PA school. Period. It does not hurt you. It only helps you to wait a few years and actually get clinical experience. I think a
Mm,
lot of people especially now, are trying to go straight from like high school, college, straight into PA school, and that's really not how the profession was created. So having a solid clinical experience is only going to make your life easier and make you a better provider kind of going into practice. I think you can do it straight through, but making sure you're getting really good quality clinical experience. I think that's part of why I've enjoyed my position and not felt terribly burnt out, is because I already knew what medicine was like on the real side of it. And
getting experience before PA school,
mhm,
I guarantee you that's going to go on deaf ears because everybody's dream is like college at 18, PA
mhm,
school by 22, married by 26 with a
yep,
PA degree and a plastic surgeon husband. Like that's the dream. And anything that's like even a little bit outside of that is non-traditional, right? Like non-traditional. Oh my
so I
God,
was
I'm so old. I'm getting into PA school at 24. Guys, breathe. It's
yeah, I was
okay.
one of the oldest students. Like our class was split, so only
Uh,
24 of us were up at App State's campus in Boone. And of the Boonies, we called ourselves,
Booties.
I was the second oldest in the class, and I graduated at 27.
Wow.
Yeah, I'll be 30 this week, and I'm like one of the oldest people in our whole class. So
Well, happy birthday, first off.
yeah, thanks.
And second, I don't know what that makes me. I think I was 29 and I turned 30 in PA school.
Hmm.
We had a few people in their 30s, but I've heard of people in their 40s going.
Yeah, we
And I
had
just,
we had a couple in their 30s, and we had one guy in his 40s, but he had been military, like
nope.
overseas. He was like doing surgery, like so he just needed the piece of paper. Like he was teaching us lectures sometimes, so
He was,
like teaching.
yes, he was Navy.
I don't know. I just know he wasn't allowed to tell us everything he did.
Yeah. He was an IDC probably. And I think that's what it is, independent duty corpsman, where, yeah, like surgery, you think she's exaggerating. These guys have like battlefield experience and they can do stuff that like surgeons wouldn't even touch out
Yeah,
here, trauma, all kinds of stuff, just because like there's nobody else. But
and
this guy's like,
he
huh?
works in trauma now. So
Yeah, that's what it is because that's his. He's had so much experience in it. He's actually probably frustrated because he can't do as much probably in America that he did overseas, even as a PA. But man, there's so much you could do in the military. But anyway, yeah. So if you could get some experience because Courtney feels so much better taking care of these very sick patients, since she's had the experience. But people aren't going to listen to that. They want to go straight through,
which you
which
can, but just
is
maybe don't find a job where you're by yourself.
yeah, yeah, for sure. But anyway, so we're actually in the same area. Right now I'm in Ohio, but we live in the same area. So I'm probably going to do a longer, more formal interview with Courtney if she wants, where we talk about, YPA, how she got in, her stats, which we're not telling you on this video. Tune into the next one. But this one's mainly about just NHSC, how you can get PA school for free and then, not have student loans. But yeah, thank you guys for watching. Courtney, any parting words?
Good luck with PA applications, and hope you guys are all my peers in the future.
Absolutely.